to lecture number 11, Fixed Prosthetics. So fixed prosthetics is the branch of dentistry that's involved with the restoration or placement of one or more teeth on the dental arch. It's also known as crown and bridge. Direct restorations include amalgams and composite resin restorations, and they're fabricated in the mouth while the material is soft and adaptable to the tooth. Indirect restorations are fabricated in a dental laboratory from precise impressions or digital scans and that are taken of that prepared tooth. The tooth must be prepared by the dentist to allow the prosthetic to fit into place with minor adjustments. The completed restorations are cemented, bonded, or luted into place. Examples of indirect restorations include crowns, inlays, onlays, veneers, and fixed partial dentures or bridges. So some types of fixed prosthetic restorations include crowns, as we discussed, which can be full cast or full gold crowns, and those are made of gold or metal alloys and designed to cover the entire anatomical crown. Porcelain fused to metal crowns are PFMs, and you have a full metallic coping that's covered by porcelain or composite material. You can have partial crowns made of either metallic or porcelain or composite, and they cover more than 3, but not all of the tooth surfaces. You can have an inlay, which can be made of gold, alloy, porcelain, or composite resin. These inlays can replace the mesial, distal, occlusal, buccal, or lingual surfaces of a posterior tooth, but they do not cover the cusp tips. So they're within the tooth, an inlay. An onlay can also be made of gold, alloy, porcelain, or composite material, and they do replace mesial, distal, occlusal, buccal, lingual of posterior teeth, and usually at least one cusp. So remember, inlay in between the cusps, onlay cover at least one cusp. They usually cover, though, more than 3 total surfaces. A veneer is a thin tooth-colored restoration that covers the facial aspect of the anterior and sometimes posterior teeth. It's kind of like a contact lens on the front of the tooth. A fixed partial denture is also known as a bridge. It's a fixed prosthetic device that's permanently attached to the teeth remaining in the mouth, and it can replace one or more missing teeth. Now, this fixed partial denture has 2 parts. It has the abutment, or the tooth or implant that serves as an attachment for the fixed partial denture, and it has the pontic, the artificial tooth that's suspended from between the 2 abutment teeth. You can have post and cores. They are restorations for endodontically treated teeth or root canal teeth. The post is a metallic or resin device that's inserted into the endodontically treated pulp canal, and it's cemented or bonded into place. The core is attached to the post and fills the void where we remove decay or there was trauma. It actually kind of fills that space back up. So you have the post, and on top of that is often a core. It adds strength to that tooth. We also have dental implants, and that's a replacement of a natural tooth, and it utilizes a titanium metal device that's embedded into the patient's bone. That dental implant actually has to osteointegrate for 3 to 6 months, and the patient's bone will actually grow around it and attach. The parts of the dental implant include the implant itself, the part that's surgically placed into the bone. You have the abutment part, the portion of the prosthesis that's inserted into the implant, and it then accepts the final prosthesis, which is the crown. So the crown is that final prosthesis, and it's either cemented or screwed onto that abutment. Care for a dental implant is a little bit different than other crowns and bridges. You do have to avoid metal instruments, and instruments that are used for cleaning and scaling should be Teflon coated. Polishing should be done with a rubber cup and gel rather than any abrasive Profi paste.